Thank you very much. Can we all hear me okay? Is that coming out okay? I was over there for this morning's one, and I sat next to that speaker, and my eardrum I'm pretty sure is perforated now, so as long as you can hear me, I'm particularly looking at you with the beard there, you're okay, move along, good man. Okay, so everyone can hear me, that's great. So you may have noticed from the introductions that I'm notably lacking a CBE or any other relevant letters before or after my name. I'm reliably informed that my CBE is in the post and arriving never. But I am here not through any academic achievements, but because I'm really passionate about this topic. So I'm going to be talking to you about technology and healthcare, and hopefully, gauging by the kind of discussions I've been having today already, how we can maybe partner and help some of your businesses as you start, grow, develop, diversify, or whatever it is you're looking to do. So hopefully today will be useful for you. My details are there. If you, God forbid, want to follow me on Twitter, then that's my alias. My boss and my boss's boss follow me on Twitter. So if you want to abuse me, can you do it in person and leave that alone, because that's career limiting. But yeah, it'd be great to interact with you after today. Now, I said that I don't have the academic qualifications and that I'm here through the passion for the subject. And I just wanted to let you know a bit about who I am, first of all, before I start, because I am unapologetically passionate when I talk about this. These two are my boys. The eldest there is Liam. A little boy there is Kian, who's just turning 3 months old, a little bit of sick on his corner of his mouth. And I've got a very beautiful wife as well. The four of us, one very, very happy family. My second passion is the company I work for, which I'm incredibly lucky to have. I've been working at Microsoft for 9 years now, and I love the job that I do. I've worked in every part of public sector. I'm currently leading the healthcare team, a team of 17 people, and I really, really enjoy it, and it's a very exciting place to work. The third passion, which is not as relevant to today, is I'm a Man United fan, so we're going to skip past that. But these two are relevant for today. Now, each of us have our own stories of healthcare, and mine is no different to anybody else, but I'm incredibly thankful to the NHS for my two boys, because they both had very difficult births. They're both absolute critters when they came out. They both ripped up the rule book. Both had a poo in the womb. Liam managed to get some in his lungs. They both had problems with their umbilical cord. Both of them had heart rates that were declining severely. Both had emergency C-sections. Liam was on support for a little while, but ultimately they're absolutely both fine. My wife was managed really well through the process. We can't have any more kids, so there were some difficulties, but she's absolutely fine. So I have a family of four that are all fit and healthy and fine, and I am incredibly thankful for that. So that's why I'm very passionate about the topic, and I'm very passionate about the NHS, because I truly believe in the staff, the amazing staff that helped deliver my family and see them safely through. I'm passionate about Microsoft because I met my wife there. 9 years ago, she started the company, and I just doggedly persevered until she, first of all, saw that I was there, and then secondly, agreed to talk to me, and thirdly, amazingly, agreed to marry me. So that's kind of why I'm passionate about the company as well. Plus, we do some really good stuff. But it means I am one of those people that has a lot of faith in the NHS, and I truly want to fight for what it is. But like many of us in the room, we're probably a little bit worried about where it is right now. And what I'm just going to talk about and spend a bit of time on is just going through the situation as we see it currently and in the future, which in turn will then explain why we're doing the things we're doing in healthcare. So hopefully this is going to set some context for you. So we know that budgets are increasing. We know the cost of the NHS is increasing over time, 140 billion as it stands at the moment. And we know that proportionally out of public sector budgets, that money is increasing as well. So now 30p of every pound spent in public sector is going on the NHS. So we're spending more money, and more of the public sector funding, the public sector pot, is being spent on health and social care. However, when you spend money on something, when you increase investments, you normally expect an increase in performance. But we know that's not the case either, not through any fault within staff or people, but a fault in the system. This is A&E waiting times. What you want there is where that green line is in kind of June, July. They're at the 95% point. We haven't been at that for a good couple of years now, and it doesn't look like we're going to get there anytime soon. So that's telling us that even despite growing budgets, growing amounts of money being spent on the NHS, we're still not able to hit the levels we need to, and it's actually declining because of the strain that the system is under. Now that's just the current state. If you look at the future state, everyone's mentioned aging population today that I've listened into. 1 in 4 people by the age of 2044 will be 65 or over. And of course that brings its own problems, because the older people get, the more long-term conditions you're likely to have. So by the age of 65, you're likely to have 1 long-term chronic condition, and by the age of 75, you're likely to have 2. And that's where we see the costs come in, because when those chronic conditions come in, the cost of the NHS goes up. Not only that, but of course we're going through another election at the moment. This is very much a political football, it seems. The NHS certainly was when we were talking about the referendum, and prior to that, and I think we're going to see the NHS talked more and more about now. So even more challenges that we need to understand. If you compare us to how we do with our EU counterparts, we actually underspend on health and social care relative to our partners in the EU. We're currently under the EU average at about 10% of GDP. That was back in 2014. That means we're spending less per person on beds, doctors, nurses, and all the rest of it. But if you look at how that relates to a worldwide context, it's quite interesting to see where the US are, who are up at something like 17% of their GDP. And if you were really binary about it and said, right, if you were going to spend money on something, what is the outcome of that investment? And you picked, I don't know, life expectancy as the outcome, it'd be interesting to graph what that would look like. And if you do that, for the US in particular, they go from the highest spenders to the lowest achievers, if you like, using that very binary form of looking at it. So it's not just about spending more money will achieve greater outcomes. We know that. We also know that there's an increasing demand for A&E treatment. If you look at that period of time, it's increased 4-fold, I think, over that period of time on that graph. And a lot of this is down to the types of care being delivered. If we look at some of the systematic problems at the moment in the NHS, it's those people that have long-term conditions or who are elderly, that are at home, maybe can't get to their local care providers, their local GP, aren't getting the district nurses, maybe not getting services from their local council. And that's where we see a lot of pressure at the moment in the work that we're doing within the NHS and in local government as well. So we're left with a system where we've got 2 pots of funding, if you like, at the moment as it stands, with different pressures and different politics surrounding those 2 pots, and a very complicated structure when we think about the NHS. That is subject to political reform as well. Putting that all together is a very hard place to see innovation. It's a very hard place to be in to deliver innovation, and yet we see it all the time. We see incredible innovation coming from within the NHS, from within partners such as yourselves, and some amazing things that happen despite all of that. So it's a fascinating place to work in, but if we think about the summary of those problems and what we've talked about there, number 1 was that chronic condition. And the first pillar of what we do, what we stand for at Microsoft in terms of digital transformation or what we want to achieve in healthcare, is look at really how we engage patients differently and think about those scenarios of people with long-term chronic conditions as an example. The second pillar is all about my favourite people, the NHS staff, those wonderful people that delivered my boys, how we can help them achieve more, because they're under so much pressure to do their roles. It's not something I could ever see myself doing. So how can we help them to achieve more? The third pillar is understanding that there are real financial pressures that are born of lots of inefficiencies and lots of processes that certainly are not optimal. So what can we do to help streamline these, be more optimal, reduce inefficiencies, and all those different kinds of things? The fourth one is then how we transform the care continuum, but I'm going to come back to that one a little bit later. Now, the first example that I wanted to talk through with you today, in fact, no, I'm not, because we've just got the video working. First of all, we're going to show you the worldwide general manager, Neil Jordan, who's from the UK, based in the US now for Microsoft. He looks after our health empire, if you like, globally. And this is what he talks about when he talks about digital transformation.
It's everywhere. Breathtaking. The things we can do now, the problems we can solve, hundreds of thousands of users, millions of citizens, this is about people. That's what brings digital transformation to life. So you give it a tag like digital transformation and everyone presumes it's all very sterile and very computer-oriented, on, off, black, white, but actually it's really about making the interactions more personal, more human.
That app became this seamless piece to his care.
But the fact that technology can play just a little small part in helping deliver more real-time knowledge of what's really going on inside this incredibly complex human machine that is Winston, that is beautiful.
This technology literally saved his life.
Technology itself is not the star. Whoever's technology it is, it's how it empowers.
Just like a vital sign, let's take pictures of the back of your eye. In Azure, our systems are running.
So instead of saying, hey, in a couple years you'll go blind unless you make a change, we can say, hey, we can stop this now and we can make a difference.
It's just extraordinary. The cloud enables workloads that we haven't been able to consider before.
In the next 5 years, EpiMed in 10 to 15 countries.
The scale of their ambition was so big. The way they wanted to bring all of this data together and not just do it in one place, but do it across multiple ICUs. The cloud is the only way you can do that.
We've done a lot of taking paper to digital, but we haven't really changed how we deliver healthcare, and that's what digital transformation is.
The difference assessing a patient was amazing the first time we used it.
A service which enabled the nurse, the patient, the doctor to have this high fidelity as if they're communication without the need for them all to be in the same place.
They need information on the go. They can now get that information in the palm of their hand.
The data that we are dealing with is deeply personal. You have to be able to answer the question of, is my data private and secure? Digital transformation isn't just something that happens in the hospital. It's really about the human experience. The power of all of this is how it merges together with the amazing knowledge and art of delivering medicine today.
So there's a particular quote. I thought you were going to dim the lights there, bouncing off my head, I think, blinding several members of the audience. There's a particular quote there that I really liked from Neil. It was interesting. I had a discussion, I don't know if he's in the room actually, Mark, who I was just speaking to before we came in. And he was saying, I'm not going to come to your talk because you're going to replace people. And I thought that was a really interesting point, and one that we shouldn't be arrogant enough to ignore. We are not trying to replace people at all. If you listen to what our chief exec talks about, Satya Nadella, he talks about us trying to empower people to achieve more. We're absolutely not in the business of replacing people. And Neil's statement here was that this is all about people. It doesn't really matter what the technology is. If it can help, then that's a really key thing for him, and it makes interactions more human. So that's very much what we stand for as a company. So one of the topics I'm going to be briefly touching on is artificial intelligence and machine learning, which in our technology world, from a software provider, is the big next thing. That's what you're going to see more and more of as time goes on from the big players like Amazon, Google, Microsoft, and others. We have a very different stance as a company to others in that space. We are not, as a company, about showing our artificial intelligence beating humans at games or doing things like that. So you don't see us kind of demonstrating in that form. We're very much about empowering people to help them in their roles. And that's what I'm going to talk a little bit about now. But it's an important statement that I wasn't going to talk about, but after Mark accosted me outside, and rightly so, I wanted to just make that point. So the first example I wanted to talk about on this Engage Your Patients is a really good example of partners, companies, using their software, their platforms, their devices, their applications, and then including the Microsoft platform within that to help them give a better service or improve the solution that they sell out to the market. This is with Poole Hospital, and it was specifically around epilepsy. I believe they've got about 8,000 epilepsy patients that have epilepsy in their area, 4,000 of which are seizure-free. So they treat on an ongoing basis 4,000 with an existing seizure problem. They've put together a solution that basically, if I was an epilepsy patient, just involves me wearing some devices that then feed information back to my smartphone on an application that you can download today, by the way, it's completely free. That information is not only fed to my smartphone, but equally to my care team, so that anything that's happening to me from my devices, maybe my heart rate changes, maybe my, lots of other things that within me change, are fed back straight to my care team, and they can spot correlations or issues that they need to then preempt potentially and help me maybe change my diagnosis, change my medication in real time. So it's secure, it's an ability to communicate between a patient and their care team. I have a long-term condition myself, and I see my rheumatologist once every 6 months, but there's no interaction between that. This type of system enables the patient, me, somebody with a long-term chronic condition, to have more power and more ownership over my condition and over my medication. So I can feed in various inputs. If I've got a Fitbit or a Google Fit or something like that, I can feed that information in, and lots of other different things that then go back to my care team. They can spot trends and then interact and prevent, potentially, things from happening to me. For an epilepsy patient, and if you look at the video that we've got online, it interviews epilepsy patients that are suffering, and using this, it totally changes their life because it gives them control back, which is something they didn't have before. Their aim, ambitious, is to get from 4,000 to 2,000 patients that have seizures by using just this system. As partners in the room, this is just basically, in terms of Microsoft technology, our health platform, which is Health Vault Insights. Last year, if you came to the conference, one of my colleagues talked about Health Vault. Health Vault is basically a personal health record. It's completely free, it's safe and secure. You can customize it, you can include it into applications that you may have or into electronic patient records at hospitals and the like, and you can feed information from data sets like Fitbits, etc. What it gives you, though, is a route to a personal health record for patients. So it's a really powerful example where we're engaging patients in a different way through our partner community, and the partners in that case were Shearwater and GraphNet, who are different sizes of partners but built this together. Second one I want to talk about is really focusing on the care teams. So South London and Maudsley, a massive trust, a very charismatic CIO, Stephen Doherty, who does actually have an Irish accent as opposed to me, who has an Irish name and is a complete fraud. But he looked at how people in his trusts were using technology. And they were going in, turning on their computers. 15 minutes later, they'd be able to actually use the thing. They'd go off and have a cup of coffee or something like that. And fundamentally, technology was not enabling anybody in that hospital at all in terms of our platform. So he put in a whole collaboration platform. It's called Office 365. If anybody knows Skype, if you've heard of Skype or Skype for Business, that sits within this, as well as email and lots of other different things. But safety, security, and compliance is built into this. So if any of you have businesses that rely on data being shared or transferred or anything like that, the Office 365 platform has that built in its core to protect the users when they're trying to share data. For example, if I'm somebody in a hospital and I need to email something out to a local government organisation and it's an attachment, built within this is something that will make sure that if that has like NHS data, for example, NHS numbers, and you as a hospital have decided we're not going to share this, then me as the end user, when I'm trying to email, it will instantly block it and say, no, you can't send this. It's data that can't be shared. Or it could say, you can share this, but you need to provide a business justification. That's not anybody doing anything. That's automated. And one of the big barriers we see in technology adoption and innovation in the NHS is this risk aversion, this fear of being on the front page of the Daily Mail. And I get that. I really get that. Especially if you see all the cyber attacks that are happening very pointedly at the NHS at the moment. Our technology has this built in to protect end users against these kind of attacks. So if you have businesses that could connect with that or interact with that or partner with that, then that's certainly worth having a look at. The third one is just a very simple one, but when we talk about taking cost out of the NHS, one of the best examples we've seen is NHS blood and transplant. If you've ever donated blood and you've used the application online, that's all built and run on our cloud platform. It enables scale, so lots of you in the room may be thinking about how you grow your business, how you scale your business, how you reach more people. This is a great example of just how to do that, and this is through the Microsoft Cloud. So if you imagine just great, big, enormous data centers that you can get access to with all the unlimited compute power and storage at your disposal, this is how they achieve those kind of savings. It's through just that. The last one is something that people don't really know us for at all, and this is where we're thinking about how as a company we are transforming the care continuum and what we can do as people that build products and solutions and technology can really do to have an impact. Two things I want to raise here. The first of which is genomics. Now, I'm not going to pretend to you that I can give you a lesson in what genomics is, but I understand the importance of it. Sequencing genomes helps us understand big diseases like cancer and how we can fight them better. But it's previously been something that's been so out of reach that people haven't been able to do it. Just 10 years ago, to sequence one genome would cost you $100 million. That would take 2 weeks to do, to sequence that genome. Today, and actually my information's out of date, but today, as it stands, to sequence one genome costs $1,000, and you can do tens of hundreds per day if you wanted to. If you look at that rate over that decade, that period of 10 years that I've just articulated, that is faster, that drop in price is faster than Moore's law. And that is just because of the rate of change that is happening with technology and the access to big cloud platforms like Microsoft, like Google, like Amazon, that give you that level of power at your fingertips to be able to do things like that. The second thing is a project called Inner Eye, which I wasn't going to talk about, but again, Mark's really influenced my speech, because this is again showing how we're assisting, not replacing humans. If you have a brain tumor and you're looking as a radiographer or whoever to put a care plan in place, one of the things you have to do is take the CT scans and then draw around that tumor to get as accurate possible picture as you can of that tumor, which is obviously really important as you're then deciding what type of treatment you're going to be giving them, and protecting the area around the tumor as well, which is really key. This Inner Eye project basically takes those CT scans, creates a 3D model of that tumor that is precise and enables any radiographer to give a very precise level of treatment at that tumor. It takes the time to do this job from 40 minutes down to under a minute, and it's precise as well. It's precision built in to the platform. That's all machine learning and artificial intelligence with the Microsoft Cloud Platform. So it's a really impressive thing that we produced there. But what was great from interviewing people that were using it is it not only enabled them to be precise at the start of the treatment, but as treatment went on over time, they were able to continually look and assess at the change of the tumor. Something that was previously not able to be done because of the time it would take, now can be done very, very quickly, which makes them able to give much more precise treatment. And then after the treatment, after that's finished, they can then assess and look back at what's happened and make changes or learn from what they've done. So it's a really powerful example of how, hopefully, you're seeing us as a company that's trying to assist, not replace people. Now, the point of the topic that I really want to spend some time on here is how we can work with SMEs and startups. I said at the beginning of the talk, and I've said to a few of you in the audience, that we're doing a lot of work with companies that are selling services, providing devices or whatever into the NHS. We're not doing this by design as much as I'd like us to at the moment, but just even being unstructured about it, we're seeing a huge amount of traction. These are some of the assets for you if you are a Microsoft partner or thinking about being a Microsoft partner. So things like resources and access to customers you'd expect, technical consultants you'd expect as well. We give funding to help with webinars and anything where you're looking to go to market and get to a wide audience. We provide funding for that. We give you access to research and development. So if you're thinking about the field of artificial intelligence as an example, then we can engage you with our research team, which is based out of Cambridge in the UK, and then you can get access to a lot of their information, a lot of the work that they've done. Because we can't do what we need to without partners. I'm a sales manager in a team of 17 people. 17 people in Microsoft UK Healthcare that look after everything within health and care. That's everything primary, secondary, CCGs, GP practices, up to every trust, Department of Health, and a lot of private care providers as well. We cannot do that, 17 people alone. We have a partner community of about 30,000 partners in the UK currently. They employ 500,000 people as it stands. That's just the ones that we work directly with. And that's growing all the time. The opportunity for partners with Microsoft is huge. For every $1 we make, a partner makes 7. That's a fact within the UK economy. So It's something I hope that you'll be looking at or considering, and there's lots of opportunity. But right now, in healthcare, to partner with us is a really exciting time. I've been speaking to some people in the room outside. I think it was Jim Jam. I don't know if we've got anybody from that company here. Put your hands up if you are. No, I don't think they are. It was one man on the stall earlier, so I can see why. But Jim Jam use Skype to help connect patients that need sometimes a physio with the relevant physios. We don't know, we've never met with Jim Jam, never met with them, spoken to them before, and yet they're using our technology, and I love that. I love that we're able to do things like that. But we've just announced a load of other things that are going to make us more, hopefully, attractive to partners as they think about working with us in different ways. Just to highlight some of these. Skype for Health templates. If you've used Skype, you'll know it's great for peer-to-peer or person-to-person, me speaking to you over Skype. I know you're there, you know I'm there, we know each other, we have each other's identities, and it's nice to do a quick video call or discussion or instant message, okay? What it's not great for is that multiple situation where if you're a GP surgery looking to do online consultations, how would that work? We've released a Skype for Health template with all of this built in, and it's completely open source. So as a company now, you can think, well, how can I integrate voice or video or messaging on a secure platform that's scalable completely, and you can just use that and integrate it into your products. So that was a really exciting announcement for us to make. You'll see lots of discussion around bots. Again, lots of companies talking about this idea of a bot, which is in the health context useful for things like maybe triage, potentially. Again, we've released all the APIs for this. That just means, in non-technical talk, you can connect whatever products or services you have to it and use it as something to maybe add value to whatever it is that you do. Again, it's a very clever piece of kit. It's got a diagnostic symptom checker built in. It's conversational, so you don't need to understand technical terms. It's layman's. And it's very scalable as well because it's all on our cloud platform. And the last one is HealthVault Insights. And I mentioned that when I talked about the example at Poole Hospital. HealthVault Insights is a personal health record. Again, it's an application. You can download it on Apple or Android or Windows. It's freely available on there. You can add in your own information, your weight or your devices that you may have. But as a company, as businesses, you can take that and then integrate that into other data sets if you wanted to then provide that service to patients or whoever it is you're dealing with. The cloud platform that we have at Microsoft is completely compliant with UK regulations on patient data. So another barrier that we see is people worrying about what data they can and can't put into things like a cloud, a public cloud. We don't have any problems with that with Microsoft. We comply with the security principles. We can comply with everything that CESG, who were the company that were monitoring this previously for the government, put in place. So you can now certifiably put patient identifiable data into our cloud platform. So that should be able to give you the kind of scale that you need. And my best example of a company doing this is a little company called Patient Source. And they're a lovely company of 4 people. 2 or 3 of them are neurologists. I know one of the neurologists there. And he basically worked at a hospital and was fed up with their patient record system, or lack of. So he made one. And he's not a technical guy, but he knew what a doctor needed, he knew what a clinician needed, he knew what a nurse needed when they're going around the hospital doing the various things they need to do. And they created an electronic patient record. They didn't know anything about being a commercial entity, they didn't know anything about being a business, but they were just passionate about doing something challenging, innovating, as I was saying at the beginning. Working with us, they could take their idea and instead of needing to buy servers and buy infrastructure to then go and sell this, they could say to Microsoft, look, you host that for us, you put it on your stuff, and then if it takes off, brilliant, we'll just flick up the switch and we'll scale up and be able to sell it to more people, great. If it doesn't, then we just turn it down. And they're not paying for things they're not using. So it gave them suddenly, as an organization of 4 people, infinite scale to reach whoever they wanted to reach. If their product is good enough, it will work, but it won't be constrained because of a lack of infrastructure or capital investment that they may have. And I love that about our company, that we can do that and enable that level of innovation, because what they've done is fantastic. It's a really good product. We could never have built that. That's come from the ground up, from people knowing what the problem is and doing something about it. But we could give them a platform to help get their product out to market. And I'm really pleased that they've got it embedded in 1 hospital, and they've got another 6 in the pipeline at the moment. They're hopeless in terms of commercials and sales and negotiation and contracts and anything like that. But equally there, if you try and imagine how it is for them to respond to procurements in the NHS, it's almost a complete, a game changer for them in terms of they just can't do it. But we are able to, through our partner network, connect them to other partners, maybe people like yourselves in the room, that could then give them that commercial nous and that protection as partners to then respond to those procurements, because then they have size and they have substance and they have credit and things like that that they need to respond to NHS procurements. So I love that example as something that we can do to really help. And I guess that's the message I want to kind of finish on, is that this is a new audience for us, but I love that we've been invited here today, and thank you to the organisers for doing so, because we're working in so many different markets now. And the big thing that's changing in our world is this idea of the cloud, of this great enabler or the great disruptor that we're seeing now, but that just makes that 4-person organisation at Patient Source suddenly able to compete with Cerner or any of the big EPR providers like Epic or the like in this world. And I love that a company can do that, and I love that our platform can enable that. So if you're in the room and you're thinking about how you could work with us, I'd love to hear from you. But thank you ever so much for your time today.